Good day and welcome to EMTV. Medical interns with a migration background structurally receive worse grades, according to new research. During the internship, the students often feel that they are treated unfairly and they have less trust in their assessor. We are going to discuss about it with Ferayed Hok, EM reporter and medical student, and later on we will tag along with reporter Adinda to the Erasmus Badminton Association.
Honestly, it was very interesting. I usually play badminton with my sister, but this is like one hell of a different experience. But I'm gonna try and practice some more, and maybe we'll see if I improved or something. I don't know.
Well, Adinda practices some more badminton. We are going to discuss about internship for medical students of color. Ferayed, you are a medical student. To what extent are students with migration background treated unfairly?
It's a really hard question to answer that. There's been some research done on that. So for the first 3 years of the medical study, that's the bachelor, there's really no clear difference between students with a migration background and students without, or white Dutch students. The difference starts during the master's phase, which comprises of clinical rotations for the biggest part. And so what you see is that the grades that students with a migration background receive are structurally lower than those of white Dutch students. And of course, you already said it, they have less trust in the people who grade them, and they quite often feel that they're treated unfairly.
How come?
Right, so it's as complex as the question is, because when you would see one individual case of a student saying, you know, I feel like I'm being treated unfairly. I feel like this person, this doctor, this supervisor did not, you know, treat me equal to the other students. There would be quite a lot of questions, and usually you can't really say that is what's happening. But when you see it on a larger scale, the grades are lower, even though there's no real difference between the students other than where they might come from, what they look like, maybe even how they speak. And usually the things that they go through, that they see, they're quite subtle. It could be, you know, that someone would say something or ask, where are you from? Oh, you're so good at speaking Dutch. It could be, and that's a real thing, of course. It could be that someone would ask, would assume that a certain person is Muslim. Yeah. And those things don't have to be bad things, but they do show that it's clear that those students are different from the other students. Yeah. And the doctors perceive them as different. And when you see that they structurally get different grades, get lower grades, then you start to see a pattern.
Yeah, and this is of course a sensitive topic, if I may say. So how hard is it to write this article?
It is quite hard, considering I'm a medical student with a migration background. You know, I fit right in that category, and so I spoke to a few students at Erasmus MC, and it was quite particular. Every brown student that I spoke to knew about this research that had been done by Chantal van Andel, which shows, you know, this difference in grading, and really so few of the white students that I spoke to knew about it. Yeah. And what the students say really is that this research, it just shows, it provides evidence for something that they've been feeling all along, for this feeling, for this tendency that they've seen, okay. But they couldn't really talk about.
Why couldn't they talk about it?
Well, first of all, the things that they go through are usually quite subtle. It's not clear-cut racism. It's not clear-cut discrimination. At least not always. But also there's this dependency relationship. You see, students master students of medicine, they have to do these internships where they, with doctors, with specialists in several hospitals all across the Netherlands who are affiliated with Erasmus MC. And those doctors who, those are the ones who grade them, those are the ones who assess, you know, how they're doing. And so when you get the feeling that a certain doctor isn't really, isn't treating you fairly, are you going to say something about it? Will that affect your grade? Even when you see something that's clear-cut racism, so for example, a student who was doing a rotation with a gynecologist, then saw how things were going in the room with patients, where the doctor was clearly behaving differently with white patients versus patients with a migration background, being quite happy and smiling with white patients, and then just quite rude with patients with an ethnic background. Even worse when those patients couldn't speak English or couldn't speak Dutch. And then afterwards she hears how this doctor uses certain terms, terms like Moroccan people are rats, or this horrible word that we have in Dutch, which is good Marokkanen. Yeah. When you hear that, when you see that, what would this student do when it's that doctor who is the one who's going to grade her? And even when the whole hospital or the whole department knows that these things are happening, when the person who has to assess her says, "Oh yeah, we've seen this before, we've heard this from a student before," but the doctor's not racist. Trust me, I know the doctor.
Nobody wants to hear that doctor is racist.
Exactly. So even in those cases, it's really hard to do anything about it.
And so the students told you their experiences, of course. Is there one experience that stands out?
It's really, I mean, when you hear someone say Moroccan people are rats, then that really quite stands out. Yeah. But there's so much more. I think an important thing where you look at how students are graded. One student at the psychiatry department, she is getting all of these really good grades from the doctors who are with her on the department with patients, and they see that, you know, she's really really good at her job. So she's getting these really good grades, and then when she has to go to the end, the assessment that has to be done by one person in the end, and that person has just seen her once, spoken to her one time, and he says, "Well, you know, in the first week I wasn't too happy with the conversation that we had, so I'm gonna go from an 8 to a 7, which is quite weird because this doctor hasn't been with her. With her was another student, in this case a blonde student, who was not getting those good grades on the department from those doctors, but even with that, she went away with a higher grade. Wow. So even in that case, you know, would you say, is that racism? I don't know. It depends on so many things. And so what this research from Chantal van Andel does is it shows us that, you know, there is a form of racism, there is a form of implicit bias, a form of conscious or subconscious bias that doctors those supervisors have when they grade students. And that's a problem. It really is a problem because it's unfair to those students, but also because we have this diverse population of patients, and those patients would benefit from a diverse population of doctors. Yeah,
but for you, it's also very close to you because you're medical students and you're not white. Have you experienced this kind of tragedy?
Honestly, I think every person who is not white, who's been in the hospital or anywhere in the Netherlands for that matter, you know, at some point has seen something. It doesn't have to be that bad. There's just this culture that, you know, it's slowly, hopefully slowly changing. I've had the luck to, you know, not run into really horrible things, and I'm at the start of my clinical rotations, and even hearing these stories, it does quite frighten me. But I try to not I try to not have that prejudice, because going into those rotations, I should not be the one who's prejudiced. You know, that might affect how I perform, and I'm making sure that that's not the case.
Yeah, and Erasmus Medical School, Erasmus Medical Center, sorry, should do something about it, right?
Absolutely, and that's really the thing that those students are saying as well. I mean, when something happens that has this effect on them, and the effect really is that they get more passive, they get they question themselves, you know, the knowledge that they have, and it has an effect on their performance as doctors or as students. When something happens, they need to have that help there. And even though we have some things in place, like you have a confidant in every hospital you can go to, but when you have that conversation with the confidant, you say that something's happened, nothing happens after that. And those are the stories that I've been hearing, at least. You can go to your mentor at Erasmus MC, but that mentor can listen to you, but that mentor can't really do anything. In the end, you can say, you know, I want a complaint. I want to submit a complaint, and you could do that, but the process is so enormously bureaucratic, and it puts this enormous strain on the students, because they've already had this traumatic experience. It's already had an effect on how they perform, and now being months further and going to another internship, they have to still be still keep busy with the thing that happened to them, even though they're a victim of something. And so students really, they need some more help. Yeah,
they need some more, maybe new system, new structure in place.
Well, the thing is, if this research can show that there are structural differences in how they're graded, then new research would also be able to show us where those differences are, why we have those differences, and maybe even in which hospitals, at which departments, even which doctors do things that really, you know, can't happen. But on a broader scale, when it's about implicit bias, when it's about, you know, the subconscious view that you have of what the perfect medical student should look like or should speak like, then I suppose we have quite a lot of work to do, and it's much broader than, yeah.
Thank you, Ferayed, for sharing your story. I wish you a lot of good luck during your internship, and I also wish Adinda a lot of good luck with the badminton.
Hi everyone, so today it's a Sunday and I'm joined today by the Badminton Sport Association, and basically I'm going to try out how to play badminton. So if you guys don't know already, I'm Indonesian, and if you're Indonesian, like, badminton is like the biggest thing ever in Indonesia, but I don't know how to play badminton at all. Like, I would say, like, I'm really terrible at it. But today, obviously, I'm going to jump out of my comfort zone, and I'm going to try out and practice my badminton non-existent skills with these people, and I'm really excited on how to do that. So, how hard can it be? Catch me actually joining and failing.
So today is our Sunday free play. So we have our Sunday free play every Sunday, of course, from 12 to 3. And for the free play, it's just people, they have the space and they can just use it for training or matches, whatever they want to use it for.
Okay, so before I play, Michael right now is going to show me on how, like, what are the rules of, like, first timer playing, because I really don't know what these lines, I mean, you guys can see it, but what are these lines are, like, supposedly for. The way I played it, I never, like, give a set rules or anything, so he's going to explain it to me, and hopefully I don't mess it up.
The rules for badminton. Yes. So you always serve from the center blue court. So for singles, this is out. For singles, this is in. Afterwards, it's also in, but for doubles for service, this is out. Okay. So if you have an even number of points, the server, you serve from the right side of the court. So then you serve to the back left. Okay, that's the gist of it.
Okay, perfect. Thank you so much. Thank you. This is very helpful. So I just finished playing with Michael, which is like the chairman of like the Badminton Sports Association, and honestly it was very interesting. I usually play badminton with my sister, but this is like one hell of a different experience. But I'm gonna try to like practice some more, and maybe we'll see if I improved or something. I don't know. How do you like the free play sessions?
I personally really like them because you can play with whoever you want, whether someone is like a beginner or an advanced player.
I just think that really helps the most, to be honest, because you can play with either people who are at your level or maybe people who are better than you, and I think you will learn way more through that than just with regular training, to be honest. So.
I really like all the free plays. It's also nice that there are so many courts around, and then there are a lot of people who are. So we would just play doubles around, so we can accommodate a lot of people here. So yeah, it's nice, and then playing with random people around, it also improves the game.
On a scale of 1 to 10, I would actually give this a solid probably like 9, just because first of all I don't know the rules. Second of all, I don't even know how to throw the shuttlecock. I don't even know how to catch properly, so I really have so much to learn. So it was actually quite hard because I